Welcome back. Thank you very much for staying with us. Now, Nehawu members are vowing to continue with their strike for a 10% wage increase. eNCA's Manqoba Mchunu is outside Charlotte Maxeke Hospital to give us the very latest. Good morning, Manqoba. So what is the very latest from protesting Nehawu members?
Well, Mfundo protesting Nehawu members insisting that their protest, of course, will continue. Recall, Mfundo, that this protest started on Monday and there have been several court attempts by government to try and stop this strike from continuing. They went to court last week, Saturday, to get an interdict, to interdict workers from continuing with their protest. But also on Monday, they had returned to court to effect that interdict after, of course, the union Nehawu had gone to court to appeal that interdict. Again lodged another application to appeal the execution of that interdict on Monday, and so that meant that this strike was then going to continue. I can tell you that the main entrance here at Charlotte Maxeke has been affected. It has been barricaded. In fact, I'm just going to ask my colleague Mohammed Kadi while he's saying, just to give you a picture of what's happening here. As you can see, the streets here have been barricaded with rocks and burning tires. We understand that all the entrances here to the hospital have been affected. The hospital itself, we are told, is working on skeletal staff. Many of the nurses as well as healthcare workers are out here on the street. What you're seeing here are some of the patients, Mfundo, that are being turned away by the hospital. I understand that the strikers themselves are allowing the patients to go inside the hospital, but once they get to the hospital, there are no clerks to attend to them, and so they are being turned away and they are told to make other appointments. And I can tell you, Mfundo, that the police are also here outside just to monitor the situation, but as far as operations are concerned, those have been severely affected here at the hospital, and we are told that a number of staff are here on the protest line, and they are part of the protest here outside. And I can tell you that traffic also is gridlocked here because they've blockaded many of the streets that are coming here to this particular hospital. But I want to bring in some of the patients just to get a sense from them how they've been affected by all of this. And Hayla, you were just telling me that you were one of the patients who were coming here for your child's appointment, but you are not able to get help. How has this affected you?
Well, I had to take a day off work so that I can be here, and now I need to go home, sitting here since 5 in the morning, and now I have to go home because they can't assist us and we have to wait for them to call us. Until then we have to wait. So now we're going to lose a day's salary. We don't know what's happening because of this now.
Surely this must be a huge inconvenience for you as patients, but more worrying is the fact that you are needing health care right now, you're needing the services right now, but you cannot get them. Why were you here?
My son needs to have his tonsils removed, so he's booked for theatre next week, and we needed to schedule what is happening, and he needed to have his last checkup done. So now we've been sent home telling us that they'll call us to give us new appointments and to tell us when to come back. Yes.
It must be a huge inconvenience.
Yes, it is, but there's other people that's sick as well inside the hospital that needs doctors and medical treatment. So it's not just that we are important, but there are more important people in there that needs assistance. Yes.
Thank you, Helen, for speaking to us. And well, let's get to you, sir, Bashir. We are also explaining to me that you needed to get to hospital today. Your wife was here for an appointment, but she's also not been able to get the help.
Yeah, it's a situation you can't control. Unfortunately, we've left home very, very early hours of the morning because you come here and you wait because the queuing systems are so long. And then when you get here, you discover now because of the protest, unfortunately, her situation has gone from bad to worse. She needed to prepare herself for the operation. And now we come here, you must know all the costs incurred. They say they're not allowed to see it to us. And yeah, it sets everything back. But what's worse is I took note that there's very, very old people walking from here to the entrance. That's almost like 1.5 kilometers. And they should at least do something for those people, you know. And I hope the situation gets better because really, it's bad. This is bad for everybody.
And as we're talking to you, Bashir, you can actually see one of the patients here who's in a cast, having to also go back, taking a taxi back home. And this speaks to the fact that many patients are not getting any assistance here. What would you say with regards to this strike? What are you hoping for as people that need these services?
You see, I say with the strike, I understand their situation. They want increases in their salaries and so forth. But they cannot disrupt in terms of, we're talking of patients as human lives. That's more important. They should consider that and allow the doctors and people that render services to go into the hospital and to render the services to assist the people. They can go on striking peacefully, but by them cordoning off the areas, disrupting all the service delivery and stuff, it's worsening things because they're not allowing the doctors to assist us. And that's going from bad to worse because you must know when you go back home, you haven't been seen to, your health deteriorates. And what do you do from there for? So it's an issue. I think this protesting should be, I don't know, it's not working out really.
Thank you very much, Bashir, for speaking to us. Well, as you can hear, frustrations here from some of the patients that were here this morning that woken up to come and get the help that they needed from the hospital to see the doctors. They had appointments that had been made, but they're saying now that they haven't received any help. They've been turned back. In fact, they're being told that they will need to make appointments for another day. We understand that many of the wards here have been affected. There are only doctors in some of the wards that are working here, and that just tells you how health care patients or have been affected. Patients here in Johannesburg that need the services of this hospital. It is a big hospital here in Johannesburg that services quite a number of communities, and so the impact of this strike by Nehawu being felt here at the Charlotte Maxeke Hospital this morning. We're seeing quite a number of patients still that are being told to come back, that are returning, and this just gives you a sense of how serious this strike is now getting.